Well, a new study, The Impact of Drugs Across America, was released by the U.S. Drug Test Centers today.
Tonight, Q2's Jenny Fick breaks down the numbers to show us just how big the drug problem is here in Montana.
If you total up cases of substance abuse, drug crimes, and deaths, Montana ranks 18th for the state most affected by the national drug epidemic. One of the leading issues? Opioids.
Predominant opioid abuse comes from off the streets, but opioid abuse can also come from legal prescriptions.
The study, Drugs in America, shows that the epidemic contributes to a number of additional problems, including overdoses, incarceration, and death.
Overuse of opioids shuts down the respiratory system, and the overdose is basically their inability to breathe anymore.
He says abstinence alone does not work unless paired with other tools.
Our goal is harm reduction when treating people with opiate addiction. Try and provide them medication so it reduces their risk for overdose. Methadone itself has been around since the 60s for treatment for opiate addiction. And there's a misconception that it's substituting one drug for another. It's not. It's providing coverage 24 hours so the patient has the ability to control their withdrawal symptoms.
Data also shows many people relapse and overdose after leaving prison.
They leave the facility and now they're thinking they can take the same amount prior to incarceration, so now they're at risk for overdose because they can't handle the same amount. We'll be implementing a program which we include medications such as methadone or buprenorphine for people leaving correctional facilities.
Greenberg also stresses the importance of reducing the stigma associated with addiction.
Addiction is not prejudice. It affects people of all race and all age. Some people think it's a moral failing when in actuality it's a physiological dependency. It's not my opinion to see them succeed. I want to see them see themselves succeed.
In Billings, Jenny Fick, MTN News.
All right, thanks, Jenny.